Quick update here on the vaccine story. We've received just over 2 million total doses of COVID-19 vaccine, and we've administered over 1.8 million doses so far, which means 88% of our total supply has ended up in somebody's arm. We're currently #1 among the 24 states that have more than 5 million people, and we remain in the top 10 for doses administered nationwide. Very few states are administering as many doses every day as we're administering here in Massachusetts, and it's paying off, and case rates are dropping. Yesterday was the first day, and I can't remember how long, that we had 0 new COVID cases in our long-term care system. As many of you know, the FDA authorized the Johnson & Johnson vaccine for emergency use. The latest information we have on the J&J vaccine is that states won't be receiving large quantities on a regular basis until sometime around the end of March or beginning of April. That's obviously not what we wanted to hear in the short term, but having a safe and highly effective vaccine that's only a single dose will make an enormous difference once it's widely available in speeding up the vaccination process. And we all know how high the demand is for vaccines generally. We're doing what we can to speed it up, but we can only go as fast as the federal government's supply. The federal government really isn't increasing production much in the month of March. As I said, we don't expect to receive any more than the 56,000 doses of J&J we got until the end of March. And at this point in time, the number of vials we get remains pretty flat, but we've managed to squeeze 6 doses out of a vial instead of 5. So instead of getting about 135,000 first doses a week, we can manage to squeeze 150,000 first doses out of the same number of vials. We are putting every dose we get to work and doing it quickly. And as I said, as a result, we've seen big improvements in our positive case counts, in our daily case counts, and in our hospitalization rates. We're here today in Gloucester today. We're back in Gloucester today, is probably a better way to put it, to celebrate the 101st day of in-person learning here, and just finished a terrific tour where students and parents and teachers all had a chance to explain to us how terrific this has been. And I just want to say to everybody in Gloucester, what a tremendous job you've done bringing kids and teachers and staff safely back into the classroom by following protocols, by being creative and finding ways to simply make it happen. And obviously, we look forward to seeing a lot more kids get back in school between now and the end of the year. This Friday, the Board of Elementary and Secondary Education will be meeting to discuss giving Commissioner Riley the authority to determine when remote learning satisfies learning requirements for elementary schools starting in April. Around 80% of the schools in Massachusetts are in some form of hybrid or in-person learning models, but obviously we'd like to see more kids back in class more often. And as everybody knows, yesterday the Biden-Harris administration announced that K-12 educators, school staff, and child care workers would be made eligible for vaccines, and our administration has prioritized educators and early child care workers through our state vaccine distribution plan. In fact, they are next on the list, following the current group of 65 plus and people with 2 comorbidities. In an effort to streamline our process and to limit the amount of confusion between federal eligibility guidelines and state eligibility guidelines, and to coordinate with the feds, we're announcing that educators, early educators, and school staff will be eligible to begin signing up for vaccine appointments starting on March 11th, which is next week.
Sorry. Sorry.
For the record, my good friend, the mayor of Gloucester, managed to go almost 15 minutes without saying something, which, for those of you who know her well,
That's a lot.
I'm really impressed with your discipline this morning, Mayor.
I love my teachers.
Yes,
Sorry.
I know. When appointments are released next week on Thursday, K-12 teachers, child care workers, and school staff will be eligible to sign up at all 170 vaccination sites that are open to all eligible residents around the Commonwealth. Additionally, the Command Center will designate specific days at mass vaccination sites for educators to get their shots, and we'll have more details on that as we work them out. This group of workers consists all in of about 400,000 people, which means another 400,000 residents will become eligible to book appointments starting on March 11th. They'll join several of the other currently eligible groups, including everybody over the age of 65 and the folks with 2 or more certain health conditions who've been working their way through the system for the past couple of weeks. The 65 plus group and the 2 health conditions group between them represent about 1 million residents. So far, we've received enough vaccine to vaccinate so far 1/3 of the folks in that category. The math on this is pretty straightforward. If we add 11 million or 400,000 people on March 11th to the eligible pool, that'll mean we'll be back to having about 1 million people who are eligible to receive a vaccine. And as I said, we currently get about 150,000 first doses per week from the federal government. The message governors got yesterday is that we should not expect a significant increase in supply until the end of March. Therefore, it will probably take a while for all the folks who are part of this eligibility group to work their way through the system. Our estimates would be first dose appointments would probably start to cover pretty much everybody in that group about a month after they're eligible. We do want to make this change to be consistent with the Biden-Harris administration's directive. We don't want people to be confused. And while here in Massachusetts, we've been a national leader with respect to how fast and how efficiently we can administer doses, the fact remains we're still only going to get about 150,000 first doses every week. We'd like everybody to get vaccinated as quickly as possible, but it will take time to move the current folks who are left in the 65 plus and 2 comorbidity categories who want to get vaccinated through the system, as well as the 400,000 educators who would be part of this group. It's also critically important for everybody to understand the vaccines remain available for older adults and individuals with certain medical conditions. The data on this one is clear. These folks are far more vulnerable to this virus than just about anybody else, and they need to be vaccinated as quickly and as soon as possible to prevent serious illness and, in unfortunate circumstances, death. Right now, even with the approval of the Johnson & Johnson vaccine, the numbers of doses coming into Massachusetts will remain relatively consistent over the course of the next 3 or 4 weeks, which are obviously not enough to vaccinate everybody who would like to be vaccinated today. There's a lot of excitement about the J&J vaccine, and I'm first on the list to have an opportunity to put to use and deploy a single-shot vaccine, and having a third manufacturer in the process over time will make a really big difference. But Massachusetts has been notified by the feds that we're only scheduled to get 1 shipment, which we got this week, of 58,000 doses for the month of March. And that has been distributed primarily to hospitals, health systems, some community health centers, and allocated basically to be used over the course of the next week. And we don't expect to get any more until the end of March or the beginning of April. Obviously, that timeline may change. We certainly hope that it does. But that is the current guideline that we've been given by the federal government yesterday. We currently have the capacity, and I said this before, to administer far more doses than we currently receive. We hope that we will see a significant increase at some point in the future, because we do have the ability to dramatically scale the number of people who get vaccinated in Massachusetts, but we can only vaccinate with what we get from the feds. Now, coordinating a program for the entire country is obviously a complicated task. It's the most ambitious vaccine rollout in our nation's history. It's never been done before, and the stakes have never been higher, as our state and the nation and the world desperately wants to put an end to the pandemic. The process has been difficult, but through the frustrations, we should all keep in mind that if we are patient, everyone who wants one will eventually get one. People at every level of government are working this and working it hard, and so are many of their colleagues in the private sector who provide the opportunity for people to get vaccinated in so many different locations here in Massachusetts. There are many factors that play into how states and communities approach the process, but everybody's basically chasing the same goal. And we'll keep working to administer every dose we get as quickly as possible to expand capacity and to make sure everybody knows when and where they can get their vaccines. We do want to make sure that there's not a lot of confusion between federal eligibility standards and state eligibility standards, so we will follow suit with the feds to be consistent. But we obviously need a lot more doses a lot sooner than the current guidelines that that have been applied to us by the feds if we're truly going to make our way through this group as quickly as possible. And rest assured that people will get their vaccine, but people will need to be patient unless there's a big change in the available supply in the near future.